I'm just gonna talk more about some of the functional, some of the innovations that I've seen recently. And so disclosure, I don't have any, but I must say that I've been working with the industry after, all this. I decided to 11 years of training, then 22 years in academic, actually 23 now that I think. Industry last year, and now I'm going back to clinical very soon. But 3D, it's been very exciting actually. This room is cold. I told them to warm up a little bit. Anyway, 3D printing and customization. People have been playing a lot with like planning for surgery, more in oncology than reconstructive. But there is a group that I saw in Germany that they're doing pre-printing of a 3D CT scan of the pelvis to do reconstructive surgery in the urinary tract and also in the GI tract. So I thought I don't know how far they're gonna go because it's really time consuming, and there is you need a fast printing, but this is like an industrial printing they're using. But I don't know how far they're gonna go again. But it is there. There's tissue engineering and regenerative medicine, but I don't know if there's a really real future, but it's here. Robotics is surgery. Definitely, there are more than 3 new robots in the market, and Hugo here in the United States. There's the single port intuitive robot, more for oncology than reconstruction and also general surgery. And there are now robotic systems that are more ergonomically designed for the surgeons. There's a British joint venture with the Cambridge University, I think. And there are very innovative ways of bringing less cost, less expensive robot system in the market. So you're gonna see also the Korean robots coming. Biomaterials and synthetic grafts. There's a lot of research on that, as you probably know, but there are 2 European startups, but again, it's gonna take a while. Minimally invasive techniques in terms of lasers, as well as ablative technology for BPH and so on. They're really moving fast, and I'll show you some numbers. Gene therapy, molecular medicine also, and telemedicine is something that we're gonna start seeing due to the workforce issues that we have here. So what is new? Okay, disposable scopes. One thing or not, they are here to stay, and it's very interesting. The global market for this is more than $150 million by 31. So there are several things that they offer. Not only after COVID, there was this really a push for single flexible, single-use cystoscopes because that decreases the chance of infection. They're ready, they're on your shelves and ready to go. Not only that, I think patients' preference also is for that because of the fear of getting infection. And if you see, particularly in Germany and Sweden and European countries, this is something that it will also may be becoming mandatory, but they're really moving fast for this complete change due to all this, the numbers and research they're doing in terms of environmental impact, in terms of carbon footprint. And it is incredible that flexible cystoscopes, disposables, are much more environmental friendly due to lack of gas and water and actually technicians that you need, right, for SPD and so on. So, like I said, in Germany, the conversion towards single-use cystoscope is very high. And in terms of cystoscopes, there is one that I thought very interesting. I was a consultant for almost a year, and is Riverview. It is a flexible cystoscope with not only the flexible, but also one that is designed only for female cystoscopy, and also one that comes with a needle that it can be deployed for bulking agents. The only thing you need is saline. So these will decrease the cost, and the cost is about $150 to $180, and for the disposable part, and then the handle, depending on your volume, it comes free. So, and it's a high definition, and it's a Wi-Fi. So this will probably change the way that we do cystoscopy emergently, and also in places that you cannot have that tower that you have to spend about $180,000 to $250,000 just to have the light source, the video and monitor, and so on. There is a very interesting also market for the flexible disposable ureteroscopes. As you can see, there's a list. Majority of them are from companies, major companies, but there's one from Korea, South Korea. And the guy, this picture is the team of Dr. Joe and Seoul University. And during the last week World Congress of Endourology Technology, they only discussed this new flexible scope because it is a 6 o'clock working channel, and that makes a lot of difference in terms of stone treatment and upper tract cancer treatment. But I don't know how much you guys do ureteroscopies anyway, but I'm pretty sure that you do some stone work once in a while. The global market for ureteroscopy is crazy. It's about $300 million. And not only that, that compound annual growth rate is about almost close to 18 to 20% through 2030. This is huge. It's a huge market, and if you are interested in terms of investment, this is something that you want to think about it. Neurourology innovations. Well, again, with the 3D printing in terms of complex reconstruction, you can see also augmented reality, and shows like Grey Anatomy had a huge panel that is like a table with 3D augmented reality. Those are the things that you're going to see very soon, and particularly you can do for complex reconstructive surgery. You can probably design your surgery before you do it and have an idea what are the challenges you're going to have in terms of the anatomy and distorted anatomy with CT 3D reconstruction also. Advanced neuromodulation, I know there is, other than the systems that you see, there are small companies that are trying to decrease the chance of having to go to the operating room to do this neuromodulation. They're trying to design things that you can do more in the clinic setting, plus the PTNS devices that can be controlled at home, a home device that will also improve the quality of life of patients. In terms of pelvic floor physical therapy, you can see that advanced a lot with biofeedback and then electrical stimulation, like I said. Those are the understanding of physical therapy for and the neuro component that you see, and the muscle component for this area of functional urology. They're trying to bring more to home or portable devices and so on. Gene therapy and regenerative medicine is still in the research, and you're not going to see much in the clinical use. Nanotechnology and drug delivery is something that is here, and you will see more and more, particularly use of liposomes and how to deliver quickly or different ways like sublingual and other mucosal type of delivery system. In terms of cancer, why am I putting oncology here? Because you guys end up seeing all the side effects of cancer therapy and what are the complications you can see. Actually, with this new device that is called Faraday cage, this video here will show you that it's a bipolar, it's a new device, has been in the development in the last 15 years, and this is coming to, it is FDA approved, and it's already in the market more, and the private market, not insurance. Patients pay cash, and it is being done, particularly in Florida. So there is a needle that goes in the center. You place with the ultrasound, MRI fusion, and then you put this screw, and the energy ablates for 20 seconds with this processor here, and will destroy it in just 20 seconds. And you can see the impedance, that means the resistance of this tissue, and you see this getting destroyed in the ultrasound. And the interesting thing is that can be right to the capsule and the nerves and will not cause any damage there, or the urinary tract, the urinary sphincter, or the rectum. So maybe you will see less and less erectile dysfunction due to prostate cancer treatment in terms of focal therapy, less ED and urine incontinence, for those localized therapy. And then finally, this is for all the doctors, actually. There is this AI system, deep learning actually. It's a DAX Copilot, automated clinical note and workflows that will not require scribes. And this is already being used. And academic centers, I know Baylor bought it, and it ranks as #1 improving clinical experience. That means you basically record this, you can do eye-to-eye contact with your patient, listen what they're saying instead of typing. This will produce everything. Not only that, it will improve your life. Let's say that that is only 5 minutes that you save per patient, per clinician. And what you're gonna see at the end of the day, you're gonna have probably an hour or more that you can go earlier to the gym club, or a late trip to the golf range, whatever you wanna do. And also you're gonna have more time to spend with your family. But more importantly, it is now developed for orders that you want to place for admission or any other orders that you have to do for patient care. So this is everything that I had to say, and I hope that we save some time. And thank you again for investing your time to come here, spend time with us. But I think the future is very bright for functional urology, but urology in general.